The last 2 months, I have been called upon to see and reassure 8 VIPs in India and Kerala. I was really startled to find that the treatment is being messed up by a parallel stream of spiritual leaders. Please keep in mind, spiritual leaders. I don't want to name anybody. These are all highly accomplished professionals, highly placed administrators, but the treatment is being messed by spiritual leaders and astrologers. Why is this happening in India? Why is this happening in Kerala, considered to be the most literate, educated, and well-informed state? We don't know. I think the common denominator I could find in many cases is a total break of communication between the patient, family, and the treating doctor. The doctors have an excuse, legitimately so, because they are seeing so many patients, and they cannot spend more than 15 or 20 minutes with the patient. That's true, I agree. Okay, I worked here. But we need to find a solution for this. What happens is, after this 20 minutes interview with an oncologist, many of these patients are totally miserable, and somebody plants this idea of a spiritual leader or an astrologer or a homeopath or a Siddha Vaidyan or an Ayurvedic physician somewhere. And from then onwards, although they come for treatment, their treatment is taken over partly by factor X. This is a real problem. I didn't realize the enormous dimension of this issue until I came to Kerala this time. Like I said, about 7 of them, I'm just helping them to understand the nature of their disease. All 7 are under the care of spiritual leaders. The spiritual leaders tell them not to take chemotherapy on certain days, certain weeks. Defer it or deny it. Delay surgery as much as you can because your stars are not working for you. And believe me, many success in our cancer treatment, especially using chemotherapy, came from dose dependency and schedule dependency. If you don't stick to the schedule, if you don't stick to the dose, it's a total waste of your effort. And last but not the least, there are spurious drugs all over the country now. In today's Times of India, you probably would have seen some of the reputed pharmaceutical firms have been charge-sheeted for manufacturing thalidomide or lenalidomide, lenalidomide, drug we use for myeloma and myelodysplastic syndrome, totally spurious.